Good afternoon. Thank you very much for the invitation. I've been invited to speak today about the challenges of handling ethical review of COVID-19 research project and provide you with a Swiss Research Ethics Committee experience. I'm chairing one of the 7 committees in Switzerland, the one in Lausanne. And indeed, it has been a very challenging period, especially that more than ever, we need scientific answers to the challenges raised by the pandemic. And look here, I just want to remind today, there is an epidemic of fake news and misinformation. And in fact, WHO has set up a website to help people identify what they call the mythbusters. And so there is a concern about not only those fake news, but also about bad science. And I guess most of you remember this dramatic publication in the Lancet, which had to be retracted because of the lack of scientific rigors in the paper and evidence and so on. So we have to be extremely careful, and there is more than ever a need for research. So, and also there is a key questions to ask. Because of the pandemic, can we allow a relaxation of the principles, or in contrary, do we have to respect those principles and the highest ethical and scientific standards? And there is a tension here because the politicians, the public, the physicians put pressures on the Research Ethics Committee to go faster. And so how do we deal with this? And this is one of the challenges we had to cope with. And we had to cope with this challenge at a period where we had a huge increase of requests. Here I provide you the numbers of the total research projects submitted in 2020 related to COVID. You see there were 420, and clearly the applications follows the waves. During the first wave, we have had also a wave of research application. And the committee where I am the chair had to deal with this increase. And if you compare the 2020 situation with the 2019 situation, you can see that we passed from 459 to 548. This is a 19% increase for 2020 compared to 2019. And we have to say that in my committee, we were already facing an increase compared to 2018. So we had additional challenge to cope with. And you see that the first wave in Switzerland took place in March, April, May, and it coincided with an increase of research application. And by the way, Lausanne being one of the places in Switzerland where we had the most COVID cases, this is also the places where we had the most COVID projects. And my committee became, for a short period, the most active committee in Switzerland. Now, the consequences, basically, we had to double the numbers of meetings. And not only we had to double them, but we had to cope with social distancing and so on. So we moved from on-site meetings to online meetings, and every meetings right now are still conducted online. And thanks to the members, they have been very flexible. Thanks, in fact, also to the technique and the tools that were provided to us, it worked quite well. And I could say more about the practicality of coping with the pandemic and the increase of projects. But technically, we were very fortunate with all the support we got from our IT personnel and from the staff and so on. I really want to thank them because they had to cope with a lot of work. Now, the consequences, look, it's surprising. The average time in Switzerland in 2019 was 60 days in median to get final decisions. Look, in 2020, we went down to 42. And when you speak about the COVID cases, we went down to 14 days. So we cut by 4 the time to cope with this project, and my committee did not as well as the Swiss level, but I have to say again, we had the most cases, but we had to cope with that, and it was extremely interesting. Also, the connections with the other committee, and this is also a point. This was a collective actions, and we benefited from the support from our colleagues, so we were not left behind, and that was very important, these collective actions. Interestingly, we had, of course, COVID cases, COVID projects, but we also had a huge increase of non-COVID cases project, about a 10% increase. One of my good colleagues from the University of Geneva, the chair of the Research Ethics Committee of Geneva, came with these suggestions and looking at what the surgeons' favorite activities are when they are not operating, and besides doing physical exercise or reading or traveling, they put in the middle, oh, why don't I finish this project that was sleeping in my computer for the last 2 years, and finally, because a lot of the non-COVID sections in the hospitals were closed, and they had some free time, and we had to cope with that, and that was an interesting moment. What we did, we tried to prevent amateurism. And I want to refer here to a paper that I strongly invite you to have a look at, Zhang and all ethics committees reviews of application in China at the very beginning of the pandemic. This paper was published on the 23rd of March. This paper was very useful for me and my colleagues in Switzerland because we realized that there was a lot of amateurism. The pandemic came with an increase of people thinking that they were scientists and thinking that they could contribute to science just, you know, out of the blue. And so I spent a lot of time trying to tell people, no, slow down. You know, science is not something you can improvise. You need to be a professional, especially the regulation is highly complex. So we put pressure on them, and basically we noticed that we managed to decrease about 20% of the preliminary requests that we received. 18% were not submitted, and 2% we managed to convince the researcher to work together. So this allowed a better management of the workload we received. So I wrote a letter to all the research institutions within my jurisdiction, and I also wrote to the medical association, telling them, be certain that there is a feasibility of your project. We have also to avoid competitions of researchers fighting for the patients and getting access to the data, and that worked quite well. I have to say, in the University of Lausanne, they managed for some cases to have one patient in 4 protocols together, but the patient was only contacted by one study nurse, one physician, not 4 each time. So that was quite successful. And if you look at the figures, we consider that depending on the institution, we got a decrease of between 15 to 40% of the application. And that was a very, very important step, just to cope with the workload again, and also to manage that the quality of the research was not impacted. We wanted to have a good project. And now I'd like to share with you some comparison. There is this paper that I already mentioned in the Henan Provincial People's Hospital in China. You see that for a period between February 2 and March 7, they had 41 applications. For them, they approved 6 of them without remarks. We have not done it. They have rejected about 10% of those projects. We only rejected 1 project. And in fact, it was not rejected because it was a bad project and so on. It was just a necessity to coordinate with another. Still, the key number for me is we had remarks about 60% of the protocols, while we can see that our colleagues in China had also remarks about 75% of the protocols. Where did we put our focus? Look, the medical scientific aspect were very important, and you see that we have an increase of demands between 2019 and 2020. We also had an increase of concern in the domains of identifying who is responsible for what, and this is linked to this amateurism. You have physicians who suddenly want to become researchers and they submit a protocol, but they don't think about all the liability issues of the data protections and so on. And so we had to clear up and to clarify about 69–70% of the case responsibilities. And also, and that is just to show a sign about the necessity to work for the highest ethical and scientific standard. In about 60% of the case, there was trouble with the methodology, the sampling, the statistics, and so on. So we had to work on that. Last but not least, we were less stringent on the informed consent. And that was important because the consent process is very complex. What we really made sure is that it was understandable, that the basic information was there, but we also asked the researcher to put the priority on the direct contact with the participants. So it allowed us to be less demanding on the formal aspect about ICH, about the protocols. I want to conclude now, and this is important, and I want to thank EUREC because at the beginning of the pandemic, we received a request from a large hospital asking us to do about 15 projects without consent. They wanted to have a waiver of consent to do research because of the pandemic. And thanks to EUREC and thanks to the Swiss Research Ethics Association, we managed to answer with this sentence. You know, of course, we are working under specific and dangerous and scary circumstances, but this should not compromise the quality of the review, and accelerated procedures cannot be at the expense of safety. And also, we have to recognize that the ethical principles of autonomy, beneficence, and non-maleficence and justice must always be respected. And this is really the message I want to carry here. The biggest challenge here was not to play with the principles, but to the contrary, to fight for them and make sure they were respected. Thank you very much for your attention, and I look forward to the discussion later. And you can use on my presentation the links that I have provided, and so you can have more information. Thank you very much. Bye-bye.